I want to start with a number that I think most people have never heard, and that, in my view, explains why kidney disease is one of the most underappreciated health crises in modern medicine. Your kidneys can lose 90% of their filtering function, 90%, before you notice a single symptom. Not one pain, not one alarm, just slow, silent, irreversible damage accumulating over years while your body quietly compensates and says nothing. That is not a rare edge case. That is how kidney disease works for the vast majority of the people who have it. It is estimated that around 850 million people worldwide have some form of chronic kidney disease. Fewer than 10% of them know it. The rest are living their lives, tired perhaps, a little swollen around the ankles perhaps, attributing everything to age or stress or not drinking enough water. And in the background, their kidneys are quietly losing the battle. I have been practicing medicine for over a decade, and the pattern I have seen, again and again, is that the people who reach me with advanced kidney disease are not people who ignore dramatic symptoms. They are people who experience subtle, easy-to-dismiss signs for years, and had no reason to connect those signs to their kidneys. That is what this video is designed to change. By the end of this video, you are going to understand exactly what your kidneys do, why they are so vulnerable and so silent when they fail, the 7 warning signs most people completely miss, the main causes driving the global epidemic of kidney disease, and the evidence-based actions proven to protect and preserve your kidney function. Let us get into it. Function 1. Let me start at the basics, because I think the confusion around kidney disease starts with the fact that most people have a very limited understanding of what the kidneys actually do. They know roughly that the kidneys clean the blood and make urine. And that is correct, but it is a tiny fraction of the story. Your kidneys are 2 fist-sized organs sitting just below your rib cage on either side of your spine. Every single minute of every day, they filter approximately 1.2 liters of blood. That is your entire blood volume cycling through them roughly every 4 to 5 minutes. Function 2. But filtration is just the beginning. Your kidneys also regulate your blood pressure. They do this by controlling fluid volume and producing a hormone called renin that directly affects how your arteries constrict. This is why kidney disease and high blood pressure are so tightly linked, and why, if you watched my last video on blood pressure, these two conditions are essentially a feedback loop. When one fails, it accelerates the other. Function 3. Your kidneys also produce erythropoietin, a hormone that signals your bone marrow to make red blood cells. When kidneys fail, erythropoietin production falls, red blood cell production drops, and the result is anemia. That is why profound fatigue is one of the early signs of declining kidney function. It is not just that the kidneys are struggling, it is that the rest of the body starts to be affected as a consequence. Function 4. They also regulate calcium, phosphate, and vitamin D, all of which affect bone density and nerve function. They control potassium and sodium balance, which directly affects heart rhythm. They eliminate drug metabolites, toxins, and waste products from protein digestion. The kidneys are not a passive filter. They are a highly active, hormonally sophisticated organ system. And when they begin to fail, the ripple effects touch almost every system in the body. People worldwide with chronic kidney disease. 850 million. Fewer than 1 in 10 know they have it. KDIGO 2024. The reason kidney disease is so dangerous and so consistently missed comes down to a concept called reserve capacity. Your kidneys have an enormous built-in redundancy. Under normal conditions, they are working at a fraction of their maximum filtration capacity. This means that as kidney function begins to decline, the remaining healthy tissue compensates by working harder. From the outside, and even on most standard blood tests, everything appears normal. Meanwhile, the underlying damage continues. Kidney function is measured using a value called eGFR, estimated glomerular filtration rate. This is essentially a measure of how many milliliters of blood your kidneys can effectively filter per minute, adjusted for age, sex, and body size. A normal eGFR is above 90. Mild reduction, stage 1 to 2 chronic kidney disease, ranges from 60 to 90. Most people in this range have no symptoms whatsoever. Stage 3 runs from 30 to 59, still often symptom-free. By stage 4, eGFR below 30, symptoms begin to emerge. Stage 5, below 15, is kidney failure, the point at which dialysis or a transplant becomes necessary. Here is what that means in practice. A person can progress from a normal eGFR to stage 3 chronic kidney disease, with more than 40% of kidney function already lost, without experiencing a single symptom significant enough to prompt a doctor's visit. The symptoms that do occur are so nonspecific, fatigue, mild swelling, slightly elevated blood pressure, that they are almost universally attributed to other causes. This is the clinical reality that makes kidney disease so consistently diagnosed late, and so often not diagnosed at all until the damage is irreversible. Now, the part of this video that I think matters most, the signs. As I said at the start, symptoms in kidney disease are subtle, but they are there. And once you know what to look for, they are much harder to dismiss. Sign 1. The first and most common warning sign is a particular type of fatigue, a deep, persistent tiredness that does not respond to rest. You sleep 8 hours. You wake up exhausted. You get through the day on willpower. Most people attribute this to stress, to aging, to their diet, but in the context of declining kidney function, there are two distinct mechanisms driving this fatigue. The first is the accumulation of waste products, specifically urea and creatinine, that the kidneys are no longer efficiently clearing. The second is the reduction in erythropoietin production I mentioned earlier, leading to lower red blood cell counts and less oxygen being delivered to tissues. This is not ordinary tiredness. It is physiological fatigue with a specific cause, and if it is unexplained and persistent, it is worth investigating. Sign 2. The second sign involves changes in urination. The kidneys make urine, so when they are struggling, it makes sense that urine patterns change. What to look for? Passing urine more frequently at night, which happens because damaged kidneys lose their ability to concentrate urine and must compensate by producing more of it. Darker urine, or conversely very pale dilute urine, both can signal that concentration is impaired. And most significantly, foamy urine. Persistent foam in the toilet bowl that does not disappear, like the foam on a cappuccino, indicates that protein is leaking into the urine. Healthy kidneys retain protein in the bloodstream. When the filtering membranes are damaged, protein escapes. Foamy urine is one of the most specific early signs of kidney damage, and almost everyone mistakes it for the effect of urinating forcefully or quickly. Sign 3. Sign 3 is edema, fluid retention. When kidneys are not effectively filtering, sodium and fluid accumulate in the body rather than being excreted. The fluid pools where gravity takes it, the ankles and feet in people who are upright during the day, and around the eyes in the morning in people who have been lying flat. Many people notice their shoes feeling tight in the evenings, or a persistent puffiness under their eyes when they wake up. These are easy to attribute to eating too much salt, to a long flight, to being on your feet all day. In isolation, they may well be nothing. But combined with other signs on this list, edema is a meaningful signal that the kidneys are not doing their job. Sign 4. Sign 4 is pruritus, persistent itching that has no visible cause. No rash, no dry skin, just an itch that will not resolve, often worst at night, sometimes affecting large areas of the body. This happens because in advanced kidney disease, phosphate builds up in the blood. The kidneys can no longer remove it effectively, and deposits of calcium phosphate form under the skin. These deposits cause a specific type of itching that antihistamines barely touch and moisturizers do not resolve. It is one of the most distressing symptoms of chronic kidney disease, and it tends to appear at moderate to advanced stages, meaning if it is present, significant kidney damage has already occurred. Sign 5. Sign 5 is gastrointestinal, a persistent loss of appetite, nausea that is worst in the mornings and resembles pregnancy sickness without the cause, and a metallic or ammonia-like taste in the mouth. This combination is caused by uremia, the accumulation of urea and other nitrogenous waste products in the bloodstream that the kidneys are no longer removing. Urea is converted to ammonia by bacteria in the digestive tract, and that ammonia is detectable as a taste and odor. Many people with uremia describe feeling vaguely nauseated all the time, not dramatically sick, just persistently unwell in a way they cannot explain. Combined with the fatigue of anemia, this symptom cluster produces a quality of life impact that is significant and often goes unrecognized for months or years. Sign 6. Sign 6 is cognitive, difficulty concentrating, memory problems, and a general sense of mental sluggishness that clinicians call uremic encephalopathy in severe cases, but which begins much more subtly. When waste products accumulate in the bloodstream, as they do when kidneys are failing, they cross the blood-brain barrier and interfere with neurotransmitter function. The brain literally becomes less efficient. People describe feeling foggy, forgetful, unable to concentrate on tasks they previously found easy. Combined with anemia, which reduces oxygen delivery to the brain, this cognitive decline can be significant and is frequently attributed to age, mental health, or poor sleep rather than the kidney dysfunction driving it. Sign 7. Sign 7 is breathlessness, specifically breathlessness that does not have an obvious cardiac explanation. In kidney disease, breathlessness arises from two separate mechanisms. The first is anemia. Fewer red blood cells means less oxygen per breath, and the body compensates by increasing respiratory rate. The second is fluid overload. When kidneys cannot regulate fluid balance, excess fluid accumulates and can begin to fill the spaces around the lungs, making breathing harder. This is called pulmonary edema in severe cases, and it can develop rapidly and unpredictably. Breathlessness in someone whose heart has been assessed and cleared is always worth investigating from a renal perspective, especially when it accompanies fatigue, swelling, or any of the other signs on this list. Cause 1. The leading cause of chronic kidney disease worldwide is diabetes, specifically the sustained high blood sugar that characterizes poorly controlled type 1 and type 2 diabetes. Excess glucose in the bloodstream damages the tiny blood vessels, the glomeruli, that do the filtering work inside the kidney. This damage is called diabetic nephropathy, and it develops silently over years. The first detectable sign is microalbuminuria, tiny amounts of protein leaking into the urine. If caught at this stage, the progression can be slowed dramatically. If missed, diabetic nephropathy progresses relentlessly toward kidney failure. Globally, diabetes now accounts for approximately 40% of all cases of kidney failure requiring dialysis. Cause 2. The second leading cause is high blood pressure, hypertension. If you watched my last video, you will recall that I described the vicious cycle. High blood pressure damages the kidney's filtration vessels, and damaged kidneys retain more sodium and fluid, which raises blood pressure further. This cycle, once established, is self-reinforcing and self-accelerating. Every 10 millimeters of Hg increase in systolic blood pressure above 130 is associated with a significantly higher rate of kidney function decline. Treating blood pressure aggressively, ideally to below 130/80, is one of the most effective interventions for slowing kidney disease progression. Cause 3. The third cause is the chronic overuse of non-steroidal anti-inflammatory drugs, NSAIDs. Ibuprofen, diclofenac, naproxen, these medications are extraordinarily widely used and extraordinarily poorly understood in terms of their kidney effects. NSAIDs work in part by reducing blood flow to the kidneys. In short-term use by healthy individuals, this is usually well tolerated. But in people with already reduced kidney function, existing cardiovascular disease, or who are dehydrated, NSAIDs can trigger acute kidney injury. And in people who take them chronically, daily or near daily for conditions like back pain or arthritis, they cause progressive cumulative kidney damage that may not be detected until significant function has already been lost. Cause 4. Other significant causes include contrast dye used in certain imaging procedures, a particular risk in people with pre-existing kidney disease, autoimmune conditions including lupus and IgA nephropathy, obstructive conditions like kidney stones or prostate enlargement that prevent urine from draining properly, and genetic conditions such as polycystic kidney disease. For a significant number of people, chronic kidney disease develops as a combination of several of these factors acting simultaneously, and it is their accumulation over years that eventually overwhelms the kidney's reserve capacity. Now, the part that matters most, what you can actually do. Whether you have already been told your kidney function is reduced, or whether you simply want to protect your kidneys proactively, these 8 actions are backed by strong clinical evidence. Action 1. This is the single highest impact intervention for kidney protection in the majority of people. Large randomized trials, including the landmark SPRINT trial, confirm that lowering systolic blood pressure to below 130 significantly slows kidney function decline compared to the conventional target of below 140. If you have been told your blood pressure is a bit high and that you do not need medication yet, please go back and have that conversation, specifically about your kidney function. In many cases, treatment is warranted earlier than current guidelines sometimes suggest, particularly if eGFR is already trending downward. Action 2. If you have type 1 or type 2 diabetes, kidney protection starts with HbA1c control. Maintaining HbA1c below 7% reduces the risk of diabetic nephropathy by approximately 30 to 40%. More recently, 2 classes of medication have been shown to be directly kidney protective, independent of their glucose-lowering effects. SGLT2 inhibitors such as empagliflozin and dapagliflozin, and GLP-1 receptor agonists such as semaglutide. If you have diabetes and have not discussed these medications specifically in the context of kidney protection, that is a conversation worth initiating with your doctor. Action 3. Adequate fluid intake keeps urine dilute, reduces the concentration of potentially damaging solutes, and helps prevent kidney stones, one of the risk factors for progressive kidney damage. The target for most adults is around 1.5 to 2 liters of fluid per day, primarily from water. The key phrase is adequate hydration, not aggressive hydration. There is no evidence that drinking 3 or 4 liters daily provides additional kidney benefit, and in people with already compromised kidney function, overhydration can be harmful. If you are in a hot climate, exercising heavily, or taking medications that increase fluid requirements, adjust accordingly. Action 4. If you take ibuprofen, naproxen, or any other NSAID regularly, meaning several times a week or daily, speak to your doctor about alternatives. For musculoskeletal pain, there are physiotherapy approaches, topical NSAIDs which have far lower systemic effects, paracetamol, and in some cases, nerve-targeted medications that spare the kidneys entirely. For inflammatory conditions, disease-modifying treatments may be a better option than continuous NSAID use. The kidneys of people who take NSAIDs regularly are being damaged gradually and silently, and the damage is often not caught until it is extensive. Action 5. The most important action on this list is to actually know your kidney numbers. eGFR, estimated glomerular filtration rate, from a simple blood test, and urine ACR, albumin to creatinine ratio, from a urine sample, which detects protein leakage before it becomes visible as foam. Both tests are inexpensive, widely available, and recommended annually for anyone with diabetes, hypertension, cardiovascular disease, obesity, or a family history of kidney disease. If you have never had either of these tests, please ask for them at your next doctor's appointment. You cannot manage what you cannot measure. Action 6. 2 classes of blood pressure medication have a kidney protective effect that goes beyond their pressure-lowering action. ACE inhibitors, medications like ramipril and lisinopril, and ARBs, such as losartan and valsartan, reduce the pressure within the kidney's filtering apparatus specifically and reduce protein leakage into the urine. In people with diabetic nephropathy or protein in the urine, these medications are now considered first line, not just for blood pressure management, but for active kidney protection. If you have been prescribed one of these medications and have been considering stopping it due to side effects, please speak to your doctor first about alternatives, because the kidney protection they offer is significant and evidence-based. Action 7. Smoking accelerates kidney disease through 2 mechanisms. First, it raises blood pressure and impairs vascular function throughout the body, including in the renal arteries. Second, it directly reduces blood flow to the kidneys, impairing their filtration efficiency. Studies confirm that smokers with chronic kidney disease progress to kidney failure at a significantly faster rate than non-smokers with equivalent baseline function. Quitting smoking is one of the most effective things anyone with existing kidney disease can do, and its protective effect begins within weeks of cessation. Action 8. Visceral fat. The fat around the organs in the abdomen drives chronic inflammation, raises blood pressure, promotes insulin resistance, and increases the metabolic load on the kidneys. Multiple studies have demonstrated that weight loss in overweight individuals with chronic kidney disease significantly slows the rate of eGFR decline and reduces urinary protein loss. The mechanism is not just about blood pressure improvement. It is about reducing systemic inflammation and the hormonal signals that directly impair kidney function. A 5 to 10% reduction in body weight produces measurable kidney benefits in the majority of people who achieve it. I want to leave you with something important. Kidney disease, at every stage except the very end, is not a death sentence. It is a manageable condition. The people who do best with it are consistently the people who found out early, who understood what was happening in their body, and who made the changes that clinical evidence supports. That window is available to most people, but it requires knowing your numbers, understanding the signs, and not waiting for something dramatic to prompt action. If you watched my video on blood pressure and you are now watching this one, I hope the connections are becoming clear. Blood pressure, kidneys, heart, liver, these are not separate systems that fail independently. They are deeply interconnected, and the lifestyle factors that damage one are almost always damaging the others simultaneously. Understanding them together is how you actually protect your long-term health, not by treating each crisis in isolation, but by addressing the root causes before the crises begin. If this video was useful, please share it with someone who should know this. A parent, a partner, a friend who takes ibuprofen every day or has never had their kidney function tested. A share takes 10 seconds and might genuinely matter. Subscribe and hit the notification bell so you do not miss the next video, where I will be going deep on type 2 diabetes, the hidden decade of insulin resistance before diagnosis, the 8 signs your body shows you years in advance, and the actions proven to reverse it in its early stages. I will see you there.